and welcome. You're watching NDTV 24/7. I'm Sonal Mehrotra Kapoor. This is a special broadcast, and COVID-19 has reached almost all parts of the world. Just when we thought we were getting away from COVID-19, Omicron has emerged. Since it has emerged in mid-November, Omicron is spread across the globe like wildfire. Though it has milder symptoms, almost the same as seasonal flu, the WHO has warned that Omicron cannot be dismissed as a common cold or a mild disease, and there are reasons to worry about it. People with diabetes and heart disease can face severe complications. Now, due to the previous lockdown and work-from-home culture, people's lifestyles are already severely disrupted. Many people have become physically inactive and developed irregular eating patterns as well, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach then, promoting healthier diets, increasing physical activity, can help in slowing down the diabetic epidemic and heart diseases. Beat diabetes, myths and facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us our experts to share with you their advice on leading a healthy life. And if you have any questions, you can ask them, send us your questions via WhatsApp as well. The numbers on your screen, I'll read it up for you again. It's 9167 666 941. I'll say that one more time, 9167 666 941. You can send in your question, just send us your name and location along with it so we can take up those questions with the panel as well. Okay, let me take the first question to Dr. Chandani Seth. She is MBBS DNB Medicine, DNB Endocrinology, Specialty Certificate in Endocrinology and Metabolism in UK, and Consultant Endocrinologist at Indira Hospital, Mira Road. Thank you so much, Dr. Seth, for your question. Let me just come to you straight away with that then. You know, there have been cases of infections even before the 2 doses of vaccine and the booster. And people often think, how long does the immunity really last? Will it work? Have I got COVID once, or will it repeat again? What are the reasons, do you think, for COVID actually repeating itself, and the main causes really behind that?
So good afternoon, everyone. Now, this is, we have to understand 2 things here. Number one, that vaccine, there is no vaccine in the world that is 100% effective against a particular disease. So COVID vaccines are acting very nicely towards the disease. Second thing that we need to understand is about the virus mutations, that the virus will change its form for its better survival. We take a lesson from the common cold or the influenza viruses, which undergo antigenic shift and antigenic drift, which basically means mutations. And every year we get new vaccines for the same influenza according to the strain. So yes, the current vaccine composition that we have, it may escape for certain variants. But the bottom line at the end of the day that we have to remember is that all studies have shown that a vaccinated individual develops less severe disease, has lesser chances of hospitalization and lesser chances of dying from this virus. So I urge everyone to take their vaccines and their booster doses as well if they are eligible.
I see. You know, Dr. Seth, but another important aspect is that people are still unaware of the importance of regular blood sugar monitoring then. They think they will get some symptoms if their blood sugar rises. Can they experience a blood sugar rise without any symptoms?
Yeah, that's a very good question indeed, because as a matter of fact, patients will not get symptoms due to their blood sugar rises commonly. Very rarely, only when they land into something called as a diabetic coma, where the sugars are so high that the patient has to be admitted in the ICU, or they develop diabetic complications like heart failure, kidney failure, heart attack, brain attack. That is the time that symptoms will occur. Most commonly, they can have vague symptoms like lethargy, aches and pains, minor skin or urinary tract infections. So it's important to check the blood sugars. Now, somebody who already has diabetes, they can do a simple thing, is they can buy a glucometer and check sugars at home frequently. They should talk to their doctor decide or ask what their target levels are for fasting as well as post-meal sugars. And as soon as they go out of target, they contact their doctor and control their sugar levels. See, diabetes is a progressive disease. One day or the other, your sugar levels are bound to rise irrespective of treatment and lifestyle changes. So it is better to keep a check and visit your doctor. Now, another thing is that Indians inherently, they are more predisposed to get diabetes and at younger ages. So we have something called as a diabetic screening, wherein if you are more than 45 years of age, you're overweight, like your BMI, body mass index is more than 23, you get yourself screened. If you have a family history of diabetes, your parents or your siblings have diabetes, you lead a sedentary lifestyle, or you already have high blood pressure or high cholesterol, you must get the full diabetes profile, fasting sugar, post-meal sugar, and the 3-monthly HbA1c average done. Another thing is, at times we notice a blackish velvety pigmentation on the neck or underarms called as acanthosis, which can also be a predictor of development of diabetes. Other than that, females suffering from PCOD, PCOS, or women who develop diabetes during their pregnancy, or women who have delivered a big baby, more than 9 pounds or 4 to 4.5 kgs, they must get the screening done, and probably an annual diabetes screening or as and when their doctor asks. So it's very important that we check the blood sugars, get them under control, because ultimately if you're uncontrolled for a long time, that leads to diabetic complications. So check the blood sugars and as soon as possible correct them.
I see. So important points there. And also, it doesn't matter, the age is not a factor anymore, I guess. And especially after COVID, those who got treatment, took steroids, they need to be checking their blood sugar levels even more, because a lot of underlying sort of diseases have surfaced, especially if you have a family history. Very important to get that checked as well. Let me toss back to an Omicron-related question that still, believe it or not, is asked quite often, and which is Omicron milder than Delta? Does the oxygen level not dip in Omicron? What are the symptoms that are different between Omicron and Delta? And also, if I could ask you, there is now a new variant, a sub-variant of Omicron, which is now a cause of concern across the world as well. Is there something more that you know about it that we haven't talked about already?
So see, the new variants, Omicron variant is basically the pathophysiology is that it gets stuck in our upper respiratory tract. And it doesn't reach the lungs. But what we have seen is that people who are elderly or who have comorbidities, who already have diabetes or other diseases, we have seen admissions to ICU. So although it doesn't present to us like Delta virus, but there is a definite risk of hospitalization and mortality with Omicron as well. So it is not to be regarded as a common cold.
I see. So, definitely keep that in mind. Dr. Madhu also joins us now. Dr. Madhu, just to introduce her to the viewers, is MBBS MD. Beg your pardon, Dr. C. Madhu is an MBBS MD, FICP, consultant physician, cardiologist and diabetologist, Durga Bhai Deshmukh Hospital and the Vijay Medical and Heart Clinic in Hyderabad. Thank you so much for your time, sir. Just want to understand from you a little bit in detail one of the questions that has actually come to us from a WhatsApp from one of our viewers. The name is not given, but he or she in this case says, my platelets are always between 80,000 to 1,50,000 and not above that. What precautions do I need to take during the pandemic situation? Dr. Madhu, if you could answer that, please.
Yeah, good afternoon, everybody. Thank you for this opportunity. So the platelets are specialized cells in our body, which help in clotting by clumping together. The normal platelets should be about 150,000 to 4 lakhs. They can be deficient in people because of decrease in production or increased destruction by autoimmune mechanism. More commonly, we are now seeing in viral fevers like dengue fever and Epstein-Barr viruses, etc. The platelets are destroyed by autoimmune mechanism. Doctors generally check for all the viral markers to see whether any virus is destroying these platelets, or any autoimmune diseases like immune thrombocytopenic purpura, thrombocytopenic purpura, etc. are there, or any aplastic anemia, etc. are there. But still, in spite of all these tests, some people have less platelets, like 75,000 to or 80,000. And this is not exactly dangerous. The level of 50,000 or less, people give steroids, doctors give steroids, and later, less than 20,000, they need platelet transfusion. The most important thing during pandemic is we can mistake a COVID infection for a dengue infection, or a dengue infection for a COVID infection. The treatment is diametrical opposite. In COVID infection, we give heparin to reduce platelets or to prevent clotting. In dengue fever infection, we have to give platelets. So if there is a mistake in diagnosing, there is a problem of bleeding in COVID infections, or there are sometimes mixed infections. In the mixed infections, sometimes in our state also, we have got cases where there were both infections, and by heparin there were problems for these patients. So I advise this gentleman who is having low platelets to be very careful when he is having a fever, and doubly check with his doctor whether it is a virus like dengue fever or other viruses, or is it a COVID positive, or is it a mixed infection. And it is better to avoid heparin and such drugs which reduce platelets to prevent bleeding from. That is my opinion.
I see. Thanks, Doctor, for that. Let me go back to Dr. Seth with the next question, and that's also on eating habits, something that all of us need to be thinking harder and harder every day about. So generally, eating fruit is part of a healthy diet, or considered to be part of a healthy diet, but there is much confusion about fruits and people with diabetes. Which fruit do you think is safe for people with diabetes? Can they safely consume fruit juices? There is this entire, I don't know if it's a myth about mangoes, or of eating something which has too much sugar. It could be one of the berries as well. So what are your thoughts on that?
See, first thing that we need to understand is diabetic diet is nothing. It's just a healthy diet, which means you need a balance of carbohydrates, proteins, fats, and vitamins and minerals. And fruits are no different. We should take 2 to 3 fruits per day. But there is a principle involved when you are a diabetic, because these fruits also contain carbohydrates, which are the main thing that increases our blood sugar. So we can eat all fruits, but we must know about amount of carbohydrates, or the amount of the glycemic index of the fruit, which means the ability of the fruit to increase your blood sugar levels. So according to that, we decide the quantity of a fruit. Like suppose if I want to have a apple, guava, pear, orange, sweet lime, I can have 1 small to medium of that, or about 150 grams of papaya or watermelon. But if we go on to sweeter fruits, I can also occasionally take the sweeter fruits, but I have to limit the quantity. Like if I want to have a banana, I can maybe have half a banana, half a kiwi, or 5 to 6 grapes. And the other thing that is important is that fruit should be had like a snack in between meals, because our meals which contain carbohydrates in the form of rice or roti will increase our blood sugars. So the fruits should be had in 2 to 3 hours gap from your main meal, so as to not increase your blood sugars much. So we should eat the fruits, but in moderation.
I see. So control your calories or control your portions. That's what you're saying. If you have a craving, don't stop and don't force yourself to hide behind, because then you're going to go in the middle of the night and crack that chocolate anyways. So, and have a fruit as a snack is a good, really good tip over there as well. Let me go to Dr. Madhu then next. Dr. Madhu, then is it possible to control blood cholesterol? Let's talk about the other evil, really, cholesterol levels and triglycerides levels, the bad cholesterol, really, as one can call it that, and get them back into your normal range without using any medications. I know there's a huge debate about whether or not medicine should be taken if you have cholesterol, if you have bad cholesterol levels going up as well. Is that possible? Do you think it's possible for people in all age? And if yes, then how?
Yeah. Cholesterol and triglycerides are high risk for cardiac disease. Cholesterol is coming from animal sources, and also sometimes like milk and non-vegetarian food like red meat and such foodstuffs which contain a lot of fat, saturated fats, and also trans fats which are having refined fats. Refined fats are also dangerous for our health. So the fat, the cholesterol being a fat substance, it is transmitted by lipoproteins, that is fatty proteins. So with LDLs, low density lipoprotein, which is dangerous for heart disease, and high density lipoprotein, which is good for heart because it is a scavenger cholesterol and it removes the cholesterol. It is possible to reduce cholesterol and triglycerides when the levels are moderate. That means you have to check up your cholesterol lipid profile once in a while. And when the cholesterol level is, suppose it is normal is 150, if it is 170 or 180, or the triglycerides are around like that, 200, you can still control your red meat and all the fatty substances like even milk products using skimmed milk, etc., and using more fruits and vegetables in diet and avoiding saturated fats like butter, ghee, and vanaspati like trans fats. And I think in spite of all these dietary restrictions, sometimes it is very difficult to get your cholesterol and triglycerides under control. Especially alcohol must be stopped to reduce your triglyceride levels. And of course, all the other things like high fatty foods must be eaten in moderation. This may not be possible in the long run. So when you are having abnormally high cholesterol and triglycerides, I suggest the LDL to be less than 100, and the triglyceride must be less than 190 milligrams. Your HDL must be more than 40. You have to use medicines called statins, which are proved to be very useful in reducing your cholesterol and triglycerides in the long run to prevent cardiac disease. The statins have been proved to be very safe in evidence-based medicine, various trials, and they reduce about 20 to 30% of the incidence of heart attack. So first you can try your dietary restrictions, and then you have to use statins in the long run, maybe for lifelong, to prevent heart disease. And
so you're saying don't go away straight to medicines, because there's a huge debate out there to statin or not to statin amongst the medical fraternity as well. You're saying try the natural route. If it does not work, then definitely move on to medicines there and try and bring some lifestyle changes as well. All right. It's time for us to slip into a quick break, but joining us is also Dr. Sondhi now, and we'll be taking a couple of questions with him on the other side. Stay tuned. Welcome back. You're watching the Diabetes Myths and Facts, and we have with us Dr. S P Sondhi now. Just for his introduction, he's MD Medicine, Consultant Physician, Director, Omnibus Healthcare Center, Guest Faculty at Department of Medical Medicine, Subhrati Medical College in Meerut as well. Dr. Sondhi, welcome to the program. Just want to take you through a couple of questions that are often asked. One is the most common really, and I was asking this to our other panelists before you joined us as well, on is Omicron milder than Delta? And a lot of us have experienced it already, so we know. But if you could still spell it out for everyone. And does the oxygen level not dip in Omicron? What are the symptoms that differentiate it? And also the new subvariant of Omicron, which has now been sort of come out as a word of caution by WHO already, saying it could be much more infectious than Omicron. They don't know how severe or not. If you could share some details there.
Yeah. So definitely we are much better placed now than ever in this pandemic of 2 years. If you look back 2 years back, the mortality was around 20 times that of normal flu. But today it has come down to only 2 times the normal flu. Whether it is vaccination or the Omicron variant, which have brought it down, I think it is both. Omicron is still very young, just 3 months old, and we are getting more and more to know about it. We all know that it likes to stay in the upper respiratory tract, and that's why people are getting more sore throat, high fever, body ache, headache, etc. But they are not getting loss of smell or loss of taste or dip of oxygen, because it doesn't like to go in the lungs as much as a Delta variant. But let's not mistake it as milder, because if you just look back 2 days back, the mortality in India was 1,733 people died just 2 days back. And in US, still about 2,200 people are dying every day. Especially those who are old and unvaccinated have to be very, very careful about it, because they have 68 times more chances of dying with it than if they are not vaccinated. So we can sum up by saying that it may be less severe, but not mild. So let's not mistake to call it mild. Looking at the number of deaths it's still causing all over the world. Well, the new latest variant, we don't know much about that. So I think we have to wait and watch for that.
I see. Dr. Sondhi, let me come to you with another question now. This is about lifestyle factors and diabetes. What do you think are lifestyle factors that make you more prone to getting diabetes, especially if your parents have diabetes? This is a WhatsApp question actually that has come, I'm told, by Mr. Joseph from Bangalore. And he wants to understand how to actually keep diabetes at bay, even if you have it basically running in your family. What's your suggestion?
Yeah, you're absolutely right. We are what our genes are. So we are a product of our genes. And so if both of our parents are diabetic, the chances are that 40% chances are that the offspring will also be a diabetic. But human being is unique in the way that it can actually overcome the genes. And what we have to do in that case is that we have to change our lifestyle. Lifestyle has to be healthy. And there are two things about lifestyle. One is the diet which we consume. So we got to cut down on carbohydrates. We got to kind of stop sugar. Sugar is the new smoke of today. You know, it's as bad as smoking, sugar. And we got to cut down on carbs and cut down on sugars, keep the weight within the normal range as far as possible. And if not possible, at least lose 5 to 10% of our weight, and keep the exercise in a regular day-to-day routine. Yoga, aerobic, dance, playing or anything. So by all this, we can actually overcome our genes and change our destiny.
All right. So just because you're born with a family or in a family which has diabetes doesn't mean you'll end up getting it. You can control your own body and perhaps take things in your own hand. That's a good positive note to end the show on. Thank you all so much for your time. This was Beat Diabetes Myths and Facts for you tonight. Thanks for watching. Bye-bye.